Fox 5 News Live in Las Vegas. We'll be right back. And another nightmare.
This is Fox 5 News, live in Las Vegas.
It is only for 9 months.
Okay, I see where you're going there. Well, you're in luck. There is a new place for pregnant women to relax and learn a lot about their newborn. We'll explain coming up. Hey, baby, welcome back. A brilliant idea. A spa dedicated to pregnant women, just a couple years late for me, though. Medical studies show that stress during pregnancy may lead to all kinds of problems. So Belly Bliss is here to help, but it's not all just about pampering. They're also helping teach new moms valuable tools like CPR, and I'm going to try it out this morning. Joining us this morning, Dr. Quinn Vo, and also Rosemary Arroyo. And Dr. Quinn, Dr. Vo, you are pregnant for the very first time, but you've been working with babies and doing all this kind of stuff. How do you feel being pregnant for the first time?
It's really strange to be on the other side of the table. I'm used to counseling people about what to expect and helping them go through their pregnancies and trying to bring their stress level down. And it's kind of odd to be on the other side of things.
Yeah, now you really know what you're talking about. You always knew what you were talking about, but now you feel it, right?
It's much more real now.
How bad is stress when you're pregnant? I mean, what can it lead to if you don't really nip it in the bud?
Well, it can lead to preterm contractions. It can lead to elevated blood pressures, hypertension, and all these things can affect the growing fetus, your baby.
Yeah. So this is where Rosemary comes in. You open a spa called Belly Bliss that focuses on pregnant women, but all women in general. But you really do find that niche in helping the pregnant women.
Yes, Belly Bliss, we have a multifaceted spa. One of the aspects of the spa is education, where we offer all kinds of classes, and one of the classes includes Infant CPR.
Okay, you're having a class tomorrow, and we're going to tell you all about that, where you can go, how much it costs. But give me a demonstration on this little baby. Do you have a name for her?
Tina.
Tina. Good morning, Tina. Tina's in stress right now, and so you're going to show me just the basics on what mothers and basically anyone needs to know so they could help a child out.
Absolutely. So the first step of infant CPR, all CPR, is scene safety, because if you're safe, you're able to provide help. The second step would be assessment. So you just tap the bottom of the baby's foot. And
like
check for a response and see if there's any kind of response.
Now, is this like if she's fallen into some water or if she's not choking?
Well, that would line up with scene safety. If she fell into some water, you'd take her out and put her somewhere flat and hard.
Okay, so I tap her, she's not responding.
No response, then you would activate EMS and appoint someone to go call 911.
Okay. Very important. And so what do we do to her?
Okay, so the head tilt, chin lift. You just put your hand on the head and then take your other hand and tilt her chin back to open the airway. Look, listen, and feel. Put your ear next to her mouth. You're looking for the chest to rise and fall. You're listening for aspirations and you're feeling for breath. If there's no response at that point, then you are going to give 2 rescue breaths. With the rescue breaths, you got to make sure your mouth covers their nose and
mouth. So it goes all the way around. You don't just go on her little mouth, you just do the whole thing.
Absolutely.
Just put her whole head in your mouth, basically, right? Okay, so you do that.
So 2 rescue breaths, and then draw a line between the nipples, and just below that line is where you begin compressions. It's a 2-finger compression.
Because you don't want to do the whole hand because you're going to break her little ribs, right?
Right. She has a xiphoid process that you have to be mindful of.
So how many compressions?
30 compressions.
Oh, really?
2 breath. So you just
do
30 compressions. And you push hard, push fast.
Like this?
Yep.
And you're still holding the head back at this point?
Yes.
Okay.
You want to make sure the baby is supported.
So you do 30
compressions.
And then you do 2 more breaths down there. Okay.
And you would continue for 5 cycles until EMS arrives.
Okay, so when I'm doing this, it's not stressful, but if your baby or someone's baby is here and in an emergency, you get really freaked out, so it's good to know these basics.
It's good to be calm, and it's good to know the basics, because if it's not your child and you're out in the public, you can administer the help. Sometimes when it's your child, all the emotional is involved, and then it might help if somebody else steps in and takes charge.
Yeah, okay, so Belly Bliss, there's a class tomorrow. It's on South Fort Apache, 5:30 to 7, $25 a class, which you'll get certified, you'll get your card.
Yes.
And that's good for 2 years, right?
Yes, absolutely.
And also you can get a schedule of the of what the Belly Bliss has to offer. And I have to ask you, how often do you go get prenatal massages?
As often as I can.
Good for you. Good for you.
Especially since Belly Bliss is is just right upstairs from our own office.
Your office, yes. So it's good. All right, you know what? It's a great idea and good for a pregnant. Again, it's about 3 years too late for me, but that's okay for all the other pregnant.
But Heidi, it's also for non-pregnant women,
true.
so please come on by.
That's true. All right, good to go. Jason, there you go. You scored with the pregnant community.
I did, right?
Yeah, you did.
Now, do you think you can get that T-shirt off the baby and get it to me?
It might be a little big for you.
Might fit one of my cats.
Yeah.
All right, thanks, guys.